Hello dear students, welcome to the class on diuretics part 4. In this session let's learn about carbonic anhydrase inhibitors. So here is an image which is showing the proximal convoluted tubule. Here you can see proximal convoluted tubule where, as I said, it is the site 1 where the carbonic anhydrase inhibitors will be acting. Example is acetazolamide. So this will going to inhibit the carbonic anhydrase inhibitor in the brush border cells of the lumen as well as in the renal tubular cells. In the renal tubular cells, this carbonic anhydrase inhibitor is responsible for hydration of carbon dioxide to form bicarbonate, whereas in the lumen, this carbonic anhydrase inhibitor is responsible for dehydration thereby providing the carbon dioxide which will be responsible for diffusion back into the tubular cell, which combines with water to form bicarbonates. So what happens when you block these two activity? So when you block these two enzyme activities, so sodium which is getting exchanged with the hydrogen which is formed here will be stopped, and whatever the bicarbonate which is formed will not be reabsorbed. So the net effect will be loss of both sodium as well as the bicarbonate. So thereby it produces alkaline urine, but it produces metabolic acidosis. The amount of sodium which is lost here is only here you can see the amount of sodium lost will be only 5%. So amount of sodium lost will be only 5%. So that's why it is called as a mild diuretic agent, because the maximal fraction of sodium lost is 5%, because the part of the sodium which is rejected in the proximal tubule will going to be absorbed at the thick ascending loop of Henle. So coming to the in detail description, so acetazolamide is a prototype drug. It belongs to sulfonamide group of drugs, where it it produces non-competitive reversible inhibition of carbonic anhydrase. It is a type 2 enzyme which is present in the proximal tubular cells, and also it inhibits the carbonic anhydrase in the brush border of the lumen. It inhibits a type 4 carbonic anhydrase enzyme. The net effect will be there will be inhibition of bicarbonate as well as inhibition of sodium reabsorption. It produces alkaline diuresis, which is mild in nature, and maximum amount of sodium lost is only the 5%. That's why it is called as mild diuretic agent. So whatever the sodium which is not absorbed, that will be sent distally. So in the distal part, this sodium will be getting exchanged only with the potassium. So there will be more excess of potassium loss. So for the same degree of natriuresis, with respect to acetazolamide, with the same degree of natriuresis, this carbonic anhydrase inhibitor will cause marked kaliuresis compared to other diuretics. So for the same degree of natriuresis, it will cause excess potassium loss. For the same degree of natriuresis, it produces marked kaliuresis compared to other diuretics. So the excess of potassium loss will be seen with acetazolamide compared to other group of diuretics. So once it produces the loss of bicarbonate as well as sodium, potassium, the urine becomes alkaline. So if the treatment is continued, so it leads to depletion of body bicarbonate. So thereby the less bicarbonate will be filtered through glomerular filtration. As the important point here is the action of acetazolamide depends mainly on the bicarbonate. Since the bicarbonate filtered is very less, so there will be less degree of diuresis. So that's why it is called as self-limiting diuretic action. So which is the diuretic drug which produces self-limiting diuretic action? So it is acetazolamide which produces self-limiting diuretic action. So coming to the MCQ, which diuretic causes maximal loss of potassium through urine? So it is the carbonic anhydrase inhibitor acetazolamide is the answer, where for the same degree of natriuresis it produces marked kaliuresis compared to other diuretic agents. So coming to the extrarenal action, it helps in lowering the intraocular tension due to the decrease in the aqueous humor formation, because aqueous humor are rich in bicarbonate. It also reduces gastric HCl as well as pancreatic bicarbonate. These are seen at very high doses, and also it tends to raise the carbon dioxide levels in the brain, thereby lowering the pH, which produces sedation and elevates the seizure threshold. And also it brings about alteration in the carbon dioxide transport in the lung as well as tissue, which can be masked by compensatory mechanisms. It is given through oral route, and most of the drugs are excreted unchanged in the urine, and duration of action will be for 8 to 12 hours. So what will be the uses of acetazolamide? The uses of acetazolamide can be remembered in, if you remember the mnemonic, that is GAME. So G stands for glaucoma, A stands for alkalize the urine, M stands for in case of mountain sickness, and E for epilepsy. So in glaucoma it is used as an adjuvant drug along with ocular hypotensives, and it is used to alkalize the urine in case of urinary tract infection, as well as to remove the acidic drugs. And in case of epilepsy, especially in the absence seizure, it can be used as a adjuvant drug whenever the primary drugs are not effective in treating absence seizure. And also in case of mountain sickness, due to the rapid ascent to high altitude, some of the individuals will develop headache, nausea, giddiness, weakness, and insomnia, which may last for 1 to 2 weeks. The subjects will develop acute sickness. Why they develop acute sickness? Due to pulmonary edema as well as cerebral edema. So these acetazolamide provides both symptomatic as well as prophylactic benefit if it is taken 1 to 2 days prior to the travel. And other mechanism which is proposed are, it also decreases the CSF formation, and also it lowers the pH. It can also be used in periodic paralysis. So what are the adverse effects which are seen with the acetazolamide? It can cause acidosis, it can cause profound fall in potassium levels, so that it causes hypokalemia. It can, since it is a sulfonamide derivative, it can cause a hypersensitivity reaction, it can cause drowsiness, paresthesia, fatigue, abdominal discomfort. Should be very careful in case of any immunocompromised patient, where it can lead to bone marrow depression, which is a rare but it is a serious adverse effect. And it is contraindicated in patients who are having liver disease, because it precipitates the hepatic coma by interfering with the urinary elimination of ammonia due to the alkaline urine. And you should also remember that in case of COPD, acidosis may occur when you give acetazolamide. So along with that, you also should remember two drugs, that is dorzolamide and brinzolamide. Topical these are the topical agent which are used in the treatment of glaucoma. And there are other two drugs which can be used systematically. They are metazolamide and dichlorphenamide. Thank you.